So I'm going to start off with some of the things that I get most commonly asked in therapeutic nutritional ketosis and what their particular value is and my particular approach to it. And this is meant to be as a discussion rather than oh, you got to do this. These are some of the most common things that I deal with and what the rational basis behind it is and what the thoughts are. One of the most common supplements that I get questioned about is berberine. And berberine is used as an analog for a lot of people because they use it as an analog for metformin. There's a lot of literature out there that says that it helps as in terms of longevity. It probably works in the mTOR pathway, but my suspicion is that it reduces insulin resistance and it stimulates glycolysis. It has there's some really good studies on it, which it prevents the formation of adipogenesis. It reduces the formation of fat cells, de novo fat cells, and independently also lowers LDL-C and triglycerides. I think it's working primarily on gut microbiome, and it's working in the presentation some of the carbohydrates, primarily fructose, to the liver, akin to how metformin works. There is not a clear-cut answer to this, but berberine's been around for a long time, and it's one of the safest drugs that we know of. It's been shown to have some benefit in non-alcoholic fatty liver disease. It's been shown to have an anti-diabetic effect. It's been shown to have benefits in gout and obesity, and all of these things are interrelated. They're all metabolic diseases of hyperinsulinemia, and there's some discrete benefits to it. The typical way that I explain to patients, if they're interested, is that berberine is effectively extending their period of essentially fasting window. So if they use a supplemental berberine 1,000 milligrams, what it's doing is it's extending the fasting window by creating a time period that it's creating the milieu for increased glycolysis and increased lipolysis, and it keeps them from feeling hungry. There are some studies that on animal models that it shows that it increases longevity. Thank you.